Done with the reading of preface for the 5th editions. Now back to 6th edition. We'll start with the introduction to Dr. Borik's translation of the 6th edition of Hahnemann's Organon. This was written by Dr. Krauss. And after that, we'll read the preface of the 6th edition. The excellence of the Dutch translation into English of the 5th German edition of Hahnemann's Organon is thoroughly maintained throughout this English translation of the 6th German edition by Dr. William Borik, to whom the medical profession is under a huge double debt for rescuing this last authentic work of Hahnemann from possible loss and for putting it into good, clear, unparaphrased English. Twice this manuscript of Hahnemann was in danger of being lost, once during the siege of Paris in the Franco-Prussian War of 1870-71 and once in the military overrunning of Westphalia during the World War of 1914 to 1918. Dr. Borik was the main instrument for procuring this last medical manuscript of Hahnemann for medical world. Everything that Hahnemann ever wrote is of historic medical interest, for notwithstanding all attempts of ignorant, prejudiced, time-serving so-called medical historians to detract from Hahnemann his historic importance for medicine. Hahnemann remains one of the 4 epochal figures in the history of the practice of medicine. Hippocrates the Observer introduced the art of clinical observation as necessary basis for pathological diagnosis. Galen the Disseminator spread with powerful authority of the teachings of Hippocrates over the medical world. Paracelsus the Assailer introduced chemical as well as physical analysis into the practice of medicine, and Hahnemann the Experimenter discovered the symptomatic source of both pathologic and therapeutic diagnosis, and thereby made the practice of medicine scientific. In the scientific practice of medicine, we examine every patient suffering from any of the topic, plastic, trophic, and toxic diseases to which man is subject in order to obtain all the signs and symptoms of his disease, all his disease effects for pathologic and therapeutic diagnosis and prognosis. We examine by observing the pathologic and comparing it with the physiologic for diagnostic interpretation, prognostic prediction, and therapeutic application. We diagnose by classifying the pathological condition with similar pathologic conditions. We diagnose the anatomic seat, the where, that is the organ and the part of organs affected. We diagnose the physiological process, the what, that is the course of inflammations, exudations, degenerations, necrosis, atrophies, hypertrophies, aphasias, aplasias, hyperplasias. We diagnose the etiological factor and how, that is the developmental, traumatic, infectious antecedents of predisposition and excitation. We diagnose the therapeutic application at the end, that is the remedial treatment for cure and palliation, and the prophylactic treatment for hygiene and sanitation. The treatment of patients subject to malformation, malposition, malnutrition, injuries, foreign bodies, traumatic and infectious inflammations, new formations is effected with medical, surgical, hygienic means, or a combination of all these given in patient. Surgery may remove or palliate effects of anatomic excesses, defects, perversions. Food, water, air, heat and cold, light and electricity, exercise and work, massage and suggestion, as well as glands to replace glands, vaccines to call out antibodies, and sera to supply antibodies may remedy or palliate effects of physiologic excesses, deficiencies, perversions, may restore hygiene and establish sanitation. Medicine in the form of medicinal substances may remedy or palliate effects of etiologic excesses, defects, perversions, effects which are not remedied or remediable, palliated or palliable by surgery, hygienic or quasi-hygienic measures. It is impossible to know all the antecedents causative of disease consequence. Tolle causam is easier said than done. How then shall we remove or palliate the effects of medical substances? Here Hahnemann steps in to say, for the first time in history, remove the effects and you remove the disease, the cause of the effect. Caesat effectus, caesat causa. Empiric medicine guesses, recommends, tries, hits and misses, misses and hits again. Scientific medicine does not guess. Scientific medicine, like any other scientific art, compares effects, sensations and motions with corresponding effects, corresponding sensations and motions. Only the mountebanks in medicine decry methods of comparison as unscientific. All that we can humanly do and scientifically do is to observe and classify, to compare and infer. Hahnemann says we must apply medicinal substances on the basis of knowledge of their actual effects. Since it is impossible to know the antecedent causative of disease consequence, we must treat the disease effects, which we do know by medicinal effect, which we have ascertained and know. Disease effects are removed by the application of medicines having corresponding medicinal effects. So disease effect and medicinal effect are studied together, which is done by drug proving. If the disease effects are removed in toto, we have a cure. If the disease effects are removed in part, we have palliation. Scientific comparison of disease effects and medicinal effects for application leads to the diagnostic inferences of scientific medicine, makes scientific medicine possible. In 1790, Hahnemann made his celebrated experiment with China. From that time to 1939, that is in the course of about 50 years, he experimented with 99 drugs and recorded the observations of their actions in the human body. This record is found in his Fragmenta de Vibrius Medicamentorum Positivis, Materia Medica Pura, and Chronic Diseases. As the largest, the most accurate, and the most fertile of all investigations into medicinal action made by any single observer before or since Hahnemann throughout the annals of medical history. Hahnemann was in all essentials a flawless experimenter. He took 4 drachms of china twice a day. He had paroxysms of chill and fever. In this practice, as a physician, he had seen similar paroxysms of chill and fever. He had cured them with china, the Peruvian bark. No longer might it be said that the Peruvian bark cures paroxysms of chill and fever because it is a bitter or an astringent drug. The true inference stood out boldly. Peruvian bark cures paroxysm of chill and fever because Peruvian bark produces paroxysms of chill and fever. The necessity for methodical discovery of the medicinal properties of drugs was made apparent. He who says that Hahnemann should not have experimented on himself but on dogs or cats or rats or mice has not yet entered the school of scientific logic. Disease manifests itself not merely by objective signs of sensory impression, but also by subjective symptoms of motor expressions. Can the human experimenter record the subjective feelings of dogs, cats, rats, and mice? When the dogs, cats, rats, and mice cannot communicate to his understanding their subjective feelings, there are no two human beings entirely the same in health and in disease. Are dogs or cats, rats, mice more likely to human than humans are likely to one another? The routine experimenter or so-called experimenter experiments as though experiments were ends in themselves. This is the reason for the sterility of most public and private experimental stations. The experimenter experiments but does not know why he experiments. The moral justification may be that he experiments because he is paid to experiment. But where is the scientific justification? Hahnemann had a scientific justification for his experiments. That is the reason why his experiments were not sterile. Experimentation is for one of two purposes: observation for induction or verification of inductions. Experimentation is analysis, deduction, analytic deduction. We deduce from objects of nature, man or drug, properties in contrast with other properties. We observe by contrast. Observation is comparison, weighing, judging of contrasts. We compare for correspondence. We classify by resemblance. Classification is for synthesis, induction, synthetic induction. We classify, conceive for reflection, thought, judgment. We think for expression. We formulate our propositions for verification. We verify by experimentation, by analytic deduction, the formulated propositions of science, of scientific inductions. Hahnemann experimented for observation. He perceived in himself the symptomatic effects of Peruvian bark as similar to the symptomatic effects of intermittent fever he had removed in others with Peruvian bark. Who can say that China taken into healthy human body will not produce signs, objective symptoms and feelings, subjective symptoms similar to those of intermittent fever? Hahnemann had the contrast of health without the drug and disease with the drug within himself. He was not a sterile observer. Perception led at once to conception. Hahnemann conceived the symptomatic affinity of drugs for tissues, the symptom similarity of drugs and tissues as essential for medical treatment of medically curable diseases. If ever there was a clear scientific induction from scientific observation, it was this induction of Hahnemann's symptom similarity of drugs and tissues, which he denominated homeopathy, and for the elucidation of which he wrote his Organon of Medicine in 1870 and rewrote it consecutively in 1819, 24, 29 and 1333. In 1770, in 1790, I think it was 1810, and amended the edition in 1833 for this sixth and his last edition in 1842. Was he in error? Was he premature with his conception? Hahnemann was not one of those so-called scientists who collect and catalogue their perceptual facts with no more scientific imagination than is exercised by catalogers of libraries and collectors of taxes. Science is verified or verifiable knowledge produced by conception of percepts, induction of deducts. For scientific imagination, conceptuation from perception, not many percepts are needed. Was Pythagoras in error because perceiving masts and sails before perceiving the hull of a ship on the horizon? He conceived that the earth is round. Was his conception premature, untrue, because everybody except Aristotle for nearly 2000 years maintained that the earth is flat? Because it took nearly 2000 years before Columbus began and Magellan finished the rounding of the earth? Hahnemann himself saw to it that there was no error in his induction. He was his own Columbus, his own Magellan. Hahnemann treated with his own hands his own medically curable patients and taught other medical men to treat their own medically curable patients by the method of symptom similarity he had conceived in 1797. He used veratrum album for colic, nux vomica for asthma, and cured the multitudinous medically curable patients that came to him from his sojourn in Königslutter to his last abiding place in Paris. By this method of symptom similarity, the central method of scientific medical therapeutics. His were truly scientific verifications. Those that doubt this really do not doubt. They know not what they doubt. The verifications of Hahnemann convince those who have intellectual integrity for scientific conviction, who will not sacrifice their intellectual integrity to the idols of the day, who will repeat Hahnemann's experimental verification of his scientific observations and inductions as they should be repeated. Any other method than to take into a healthy body 4 grams of china twice a day to prove or to disprove the symptom similarity of china and intermittent fever is not a scientific experiment for the observation of Hahnemann. That there is symptom similarity between china and intermittent fever. Any other method than to administer china to patients suffering from intermittent fever to prove or disprove the method of symptom similarity in dosage smaller than that used for exciting the healthy body into disease action similar to that of intermittent fever is not a scientific experimental verification of the induction of Hahnemann. That symptom similarity is curative method and is medically curable diseases. Those that pursue other methods have not even the frog's legs of Aristophanes to stand upon. Pasteur, perceiving that Jenner's milder cowpox prevented the appearance of severer smallpox, conceived the prophylactic treatment of infectious diseases by milder vaccinations with virus exciting a given infection. How did Pasteur prove his conception? He took a number of sheep, vaccinated some of the sheep with milder prophylactic dose of anthrax virus, and then injected into all the sheep anthrax virus in larger doses sufficient to excite anthrax. All those sheep he had vaccinated previously with the milder prophylactic anthrax virus lived without anthrax, and those not vaccinated prophylactically died with anthrax. Pasteur, like the elder and greater Hahnemann, was a scientific experimenter and not a would-be experimenter. The era of scientific medical experimentation begins with Hahnemann and nobody else. Scientific to the core, Hahnemann experimented scientifically for scientific observation. Alert with intellectual power, he conceived his induction scientifically from scientific observation. Uncompromisingly scientific for experimental verification, he verified his induction scientifically for all time on his patients and made his method of symptom similarity for all time the central curative method of scientific medical therapeutics. For over 100 years, this method has been consciously and unconsciously followed by medical profession. The results substantiate Hahnemann's contentions. There is no greater achievement than to have scientific truth, pass it on, have succeeding generations follow it and express it. Hahnemann's Organon of Medicine goes out to teach symptom similarity as the experimental basis of pathologic and therapeutic diagnosis as the Echte Heilweg of scientific medicine by James Krauss, MD, Boston, September 30, 1921.